Hello everyone. Hope you all are doing well, and I am Vidit, your friend. And today we have as some guest Dr. Nabil M. Sir, who has completed his MBBS and MS from Kurnool Medical College, and Sir is currently part of NHS Trust in the Imperial College of Healthcare. Sir has many great achievements in the field of surgery and many awards in the field of surgery. Sir has great experience in the surgical hands, and Sir has extremely well done in surgical oncology part and renal transplant as a fellow surgeon in the Hammersmith Hospital. Today we will try to dig out as much as information, sir, information from Sir you to about the surgical branch as a specialty for our students, and we'll try to take all the detailed information about being surgical specialty for future perspective and all the detailed information. So welcoming you in this podcast, and I am extremely honored to have one-to-one conversation with you. So
Thank you so much, Yash. Same here.
okay. Okay. So, sir, just let's start with the general introduction about the surgical specialist as a branch.
So I'll start with the how surgical specialties are divided in India. So you have a basic general surgical. This may not hold true for every surgical specialty, but in most of the surgical specialties,
Yes.
you have a basic general surgical residency program for 3 years, and then after that you have it could be DNB or MS, and then after your general surgery basic training, then you have super specialty training, which is spanned again over a period of 3 years. This is called MCH or DNB super specialty again.
Okay, okay, sir. Sir, what things you were love about the surgical has been? Is this your dream branch or you just?
Yeah, so we will come to that question in a short time, but let me explain a little more briefly about the basic surgical
Yes, sir.
specialties.
Definitely.
So, broadly, surgical specialties also include general surgery, apart orthopedics, ENT, and gynecology and obstetrics, and to a
Yes.
small extent, ophthalmology. I don't know if people would agree with me whether ophthalmology comes into a surgical branch or not, but I would definitely consider it to be a part of
Yes.
surgical specialty. So the thing is, there are a lot of after general surgery when you go for your super specialization, there are a lot of options you have, like which span from neurosurgery, plastic surgery,
Yes.
and aesthetic surgery, which is into a lot of news these days, and urology, GI and hepatobiliary surgery, urology, surgical oncology. These are the things. And in gynec, there is a fertility subspecialization and gynecological oncology, minimally invasive gynec, and ENT. It has got some skull-based surgery. They are into some part of cosmetic surgery again, and what else? I don't have much knowledge about ophthalmology, how it is subdivided, so I'll not go too much into details.
Oh, okay, sir. Okay. Sir, is this surgery was your dream branch or you just?
To be frank and honest, I had some dilemma after my MBBS whether I should take a medical specialty or a surgical specialty. But depending on my personality, I always believe in spontaneous interventions rather than some medication spanned over a period of time. So
Yes.
after I got some clarity, I was still confused between orthopedics and general surgery, but I opted for general surgery at the end.
Okay. Sir, what is the main things you love in this branch of surgery as a being specialist?
The things that I love about a surgical branch are obviously the first thing is you get to do some cutting and perform some surgeries. And I
Definitely, sir.
also love how this is my personal opinion with my utmost respect to all my physician colleagues and other medical colleagues. I also love how the day or the week of surgeon is divided into
Fast.
different activities like or parts, like you do some theater over a week and do some outpatient activity, and you do some teaching. You can obviously do some teaching, and you have a free day where you uh, take care of the patient at your wards and everything. So I always like that rather than sitting in the outpatient services from morning to evening and maybe seeing some x number of patients.
Okay, so I can say the surgical is a branch of IPD and OPD. We can take out as a operating stuff and ETC, all the kind of mixed branch we can consider too.
Mhm. You have some
Sir, is there?
emergencies as well, trauma and everything.
Yes. Sir, is there any cons? I have not asked this question, but is there any cons of being surgical specialty or in the surgical?
Yes, definitely there are cons to everything, and the cons of being in a surgical specialty are there is a very long learning curve.
Yes.
So your learning curve, it's a bit slow at the initial phase and the middle grade phase of your surgical career. But as you progress in your surgical career, your learning curve will become more and more steep, and it will progress much faster. To explain you in an example, a person who has done all the basic surgical stuff and laparoscopic stuff, it
Yes.
will take less time for him to learn robotic stuff. So
Okay.
as you progress, your learning will improve very fastly, and your curve will be more and more steep. That's what I say. So definitely we cannot ignore that there is a long learning curve. And
Yes.
one of the cons of surgery that is specific to Indian surgical training, I must say, is in India, the surgical training is bound by time rather than the number of procedures you do when compared to
Yes.
UK. So in India, the surgical training is like you have completed 3 years of general surgical training. We don't care what you have done and what you have not done. Just get out of here. We are no longer liable to teach you.
Yes, sir.
So if you get a COVID pandemic for 1.5 years out of 3 years, then you're literally screwed because the training structure is
Definitely.
such a way. But in UK, one thing I like about this country is the training is bound by number of procedures you do. For example, if you're a colorectal surgeon in training, then you
Okay.
have to compulsory do either 200 or 250. I don't know the exact number. Some number of colonoscopies with 90% cecal intubation rate, and unless you clear that, you cannot be. They don't give
Yes.
a certification of completion or whatever.
Okay.
So if
Okay.
you are a hepatobiliary surgeon in training, then you have to do some hundreds of 100 or 150 whatever laparoscopic cholecystectomies. Unless and until you complete those, they're not gonna clear you. So that's
Okay.
the way training is here. But I think the Indian surgical training should also adopt such a system where they uh, give importance to the number of procedures that you have documented or done rather than period of time. Do you agree with me, Yash?
Okay, definitely. So, sir, it is kind of the quality work we can get in the surgical field, we can say, because if we continue being part of this particular specialty and we have done an example 250 surgeries, so we can definitely see the improvement in our surgical hands too. I can
Yeah,
agree with
that's
you
true. That's true.
totally.
And one more important thing is there should be a body like the Royal College of Surgeons in UK. There should be a similar body in India which oversees all the training of the
Yes.
surgeons rather than a common body for all the physicians and uh, surgeons
Okay.
and everybody. And one more con, I have spoken about two cons. One is the learning curve, which is
Learn.
longer,
Yes.
and the no importance being given to how many procedures you have been through
Yes.
in your surgical training. And the third one is in India, you are at the mercy of your train. If you're a trainee, you are at the mercy of your professors, your seniors, your local government,
Definitely,
uh,
sir.
whatnot. When I was a trainee in Andhra Pradesh, there was a scheme called Arogyashri scheme, and this scheme it took away all the patients from government hospitals to the corporate hospitals. So that was a major loss. I don't know ultimately if it was of any benefit to the patients, but it was of great loss to the surgical trainees. So you're at the mercy of government, and some seniors, they are like, I have not done this in my first year, so I will not allow my first year to do that. I have gone through this difficulty, so let him go through the difficulty as well. Let us not make anything easy for him. So uh, these are the cons.
Okay, so is there any with the difficulty we are facing in the first year that will be continued through our residency, and that will be difficulty for our in particular practice also, that I can get it from you?
All the surgical seniors should make it a point that they make sure that their juniors don't go through the same difficulties that they have gone through.
Yes, yes. Okay, sir. Okay, totally agree with you, sir. That is the being
Mhm.
merciful thing we can expect in the surgery. Okay. Sir, is there any particular gender dominant branch of surgery or any particular personality should avoid this surgical specialty?
Yeah, so in a single question, you have asked me about two things. One is the gender
Gender.
differences in surgical specialties, and one is the type of personalities that should be choosing surgical specialties. So, first of all, I'll speak about the type of personality. When I was in a dilemma where I was at crossroads and I had to choose between a medical specialty and a surgical specialty. I was just going through some articles in the internet, and one of on Facebook there is a group called Learning General Surgery. You might be a part of that group as well. That is a very active group for all the surgeons.
Mm.
So somebody has posted there that there are a short story that there was a very large passenger aircraft going in the sky, uh, and the pilot was steering it through the sky, and a fighter jet comes beside the passenger aircraft, and the fighter jet communicates via the radio, and
Okay.
he uh, communicates to the pilot of the passenger aircraft and tells that, oh, your job is so boring, just see what I do, and he does all the steep landing and
Yes.
vertical lift and all the
Right.
rotations and all that.
Okay.
uh, and in his defense, the pilot of the passenger aircraft, he gives a response like, okay, now you see what I will do. And the pilot of the fighter jet, he will be anxiously watching, okay, what is my co-pilot gonna do now, what is he going to do to this plane with a lot of passengers. So he'll be
Yes.
anxiously watching, and he'll watch for 5 minutes, 10 minutes, 15 minutes, but the plane is going at a very steady speed and pace. And uh, after he got bored for a certain period of time, he asks the pilot of the passenger aircraft that, what have you done, I'm waiting for you. So
Yes.
he replies that, I had a cup of coffee and I had some lemon cake, I went to the washroom. You see my
Okay.
point?
Yes. Yes.
So
Totally understand.
it's your choice whether you want to drive a uh, fighter jet or a passenger plane. Each choice comes with its own pros and cons. So
Yes.
if you want some bit of adrenaline rush and some bit of havoc in your life or chaos which you enjoy, then you should take emergency branches, be it internal medicine or general surgery or emergency medicine or gynecology. And if you are the kind of person who likes to have a cup of coffee and have some lemon cake in the between of your work, then you better take something like a radiology, dermatology, psychiatry.
I'm kind of a second specialty, you can say, because I am trying to be in radio derma, bit in confusion.
Okay.
Oh, okay, sir. So, sir, next question my is that what is the life of resident in the surgery?
So if you mean about the life of a general surgery resident, then it spanned over a period of 3 years. And first year you do a basic pre-operative care, preparation of patients for operation and theaters, and post-operative monitoring and management, and uh, some basic stuff like lipomas, hydrocele, and hernias. And on your emergency days, you manage the accident and emergency, all the trauma cases where you
Okay.
stabilize the trauma cases and refer it to some specialists like neurosurgery or
Yes.
and in second year, in my general surgery curriculum, I had a bit of exposure to subspecialties in surgery, which included urology, pediatric surgery, plastic, uh, oncosurgery,
Yes, when it is.
and whatever neurosurgery and all that for a period of eight
Yes.
months, and some orthopedic and all that. And but in second year, we were not connected to the our parent department elective theater wise, because we used to attend specialty electives like
Professional.
urology,
Yes.
cardiothoracic. But we were still connected to the general surgical department on emergency days, so 1 day a week. So we
Okay,
used to
sir.
be at the A&E and emergency theater. And third year, or after a period of 8 months in the second year, we were back at our parent department again. And third year, most of the time it goes in study, doing our thesis and doing some elective theater and emergency theater, supervising how your juniors are working and presenting
Yes.
case presentations and all that work.
Okay. Okay. And sir, is there any particular time we can get in the surgical specialty as a resident or other stuff like curricular activities we can do?
Uh, so one thing I want to make it very clear, Yash, is that amount of time you get for extracurricular activities, it has nothing to do with your branch. It rather depends on your personality. So let
Okay,
me
sir.
explain that with an example.
Yes.
Uh, a lot of my general surgical colleagues and colleagues or my friends who were into internal medicine
Yes.
or orthopedics, when we had non-operating days or non-outpatient days, which were called as ward days, we would finish at 5 or 4:30 after our afternoon teaching sessions. Then we being the emergency, so-called emergency branches, we used to go to our college ground and play football, and
Yeah.
some of our colleagues used to play cricket and whatever. We used to go to movies and all that. But I have seen my colleagues in psychiatry, radiology, dermatology, whatever the non-emergency branches are, they coming to their rooms at 2 p.m. and then cribbing for some time that, oh, we should have completed it at 1 p.m. or professor made us stay for extra 1 hour. Oh, we lost our sleep and all. Then they have their lunch and sleep till they wake up in the
Okay.
evening, and then they, after all the things, they start feeling empty and kind of
That's
doomed in the evening.
cycle will
So
repeat and go and go.
yeah, and they don't get to sleep early because they're not tired, obviously, and they had a very good sleep in the afternoon, and they feel the void and go into a vicious cycle of overthinking at night. So I have seen such. So I concluded that the amount of extracurricular time that you get in your life, it is uh, not completely dependent on your branch, but mostly dependent on your personality. But again, I should
Yes.
admit the fact that uh, you have some general surgical emergencies or something, then you might have to you should be
Okay.
willing to sacrifice your personal times at some points.
Definitely, sir. I understand your fact. About the personality depends totally based on
Mhm.
extracurricular. Okay, sir. So, what are the actually monetary benefits we can get as a being a surgeon?
uh, Monetary benefits, so two things I would like to make clear again here. Monetization of your skill is not related to a branch. Again, I have seen some specialties which are being chosen, um, people who are at the end of by people who are at the end of rank list. I've seen them making more money than people who choose radiology or internal medicine or the things what the rankers, top rankers choose.
Yes.
But yeah, general surgical wise, or surgical specialty wise, it is not bad monetarily, but it ultimately depends on how on your capacity to make money. uh,
Okay.
and uh, the second thing is, have you heard people telling you that don't work for money, work for passion, don't consider money while choosing a branch and all that bullshit?
Yes, definitely, sir. I am totally it now counseling. I am visiting multi faculty and getting multiple reviews from all that.
So don't listen to those people, because ultimately, uh, I totally agree that you should be doing the things you love, but let's assume that you are doing the things you love in your life, and at the same time you're struggling to make ends meet, and you're
Yes.
struggling to have some good time with your family. Then your passion is not going to
Wow.
help you. Or so it's about striking a good balance between the things you love and earning money. That's the most important thing. And one more thing, going back to the cons of surgery, one thing that I want to mention is,
Yes.
you might also have heard people telling that, oh, surgical branches are risky.
Yes. Sir.
Did you
Yes.
hear that? So I only partially agree with that statement. There is a lot of backstory to that statement, Yash. Uh, First of all, any medical branch is risky because you're dealing with life there. Human lives are
Yes.
at stake. And surgical branches, I agree that you have to deal with uh, risky situations on a more frequent basis. But ultimately, as you progress through your surgical career, you have to learn how to navigate through risky situations. You
Yes,
agree?
yes,
So
yes,
if a
yes,
patient is deteriorating and you just get startled and you just watch him deteriorate without doing anything, or you are indifferent to his pain or suffering, then you yourself are putting a doctor in a risky situation, and you cannot deny that.
yes,
It's always like if you regarding surgical risks, you have to be very clear in your communication with the patients, and you have to involve them and their family in the loop of decision making, and they recognize your efforts very quickly, and
okay,
you should be very transparent in your efforts, like, okay, I'm doing this now, this is our plan of action, this is the roadmap further, and everything.
yes,
Answer the queries with patient, then it's not a risk. You're it's definitely, it definitely involves some risk, but you can navigate through that. And to be frank, I have seen just an example. I'm not undermining any specialty, but I have seen my friend in radiology who got trashed by some patient attenders
okay,
uh, because they wanted some ultrasound in a government college at night, and he was like,
so
this is not emergency and all that and all that. So being so what puts you in different difficult situations is being indifferent to patients
from
suffering and their problems, not the branch. Do you agree?
okay, sir. Yes,
I'm citing this particular example because I it's not a people most of the people say that okay, radiology, you have very less patient interaction and all that, you have less clinical interaction, and it's the
yes,
least risky branch, but I have seen a radiologist being thrashed as well. So it's always the indifference of the doctor, not the branch. uh,
yes, good.
but all said and done, some surgical branches, the surgeons have to face risks more frequently, and they should learn to navigate through that
Yes,
in early
yes,
stages of
totally,
career.
sir. Totally, I am agree with your response in this part also. And sir, what are the like settlement years we can expect in, like, if someone wants to be a government practitioner or private or corporate practitioner?
Uh, okay, first about the government practitioner, you can settle immediately after your general surgery once you have 1 year of surgical senior residency
Yeah,
experience.
residents.
But ultimately, that depends on how many vacancies are available in the government colleges.
Hmm.
You can join as an assistant professor or a lecturer, but I feel that your growth will be very limited and nothing much.
Static growth will can make a
Yeah, and
oh,
your growth will be determined by not your surgical ability, but how a government system allows you to progress.
okay, sir.
That's the thing. And uh, in a corporate setup nowadays, Yash, it's more about subspecialty and what you bring to the table rather than your uh, degrees. So the surgical branches, they are proceeding or progressing towards the era of subspecialization. People don't want a general surgeon
So
operating on their liver or
definitely,
kidneys or
sir.
urinary bladder. They want a urologist operating on their kidneys, and a hepatobiliary surgeon operating on their liver,
Yes, I
uh,
can relate that.
and a thoracic surgeon operating on their lungs. If you
Okay.
how much ever experience you might be, if you go and say that I'm a general surgeon and I'll operate on your heart, no, I think people are not going to accept that in
Right.
near future.
Yes. And sir, what is the future growth like in the new era? We are expecting the robotic surgery in India also in many centers. So what are the futures of this being modernization in surgical field?
So, surgical field is a very rapidly evolving field. There is a lot of progress each day. If you take cancer surgery, there is a lot of progress in how the way surgery, in what way the surgery is done, the role of neoadjuvant and adjuvant chemotherapy and radiation, and the
Yes.
spacing of the surgery. and there are a lot of technical advancements like a lot of intraoperative imaging, intraoperative dyes,
Yes.
minimally invasive surgery, robotic surgery. But one thing I want to make it clear is most of the undergraduates, because they don't have a clear picture or a bigger picture of the surgical branches, they will be, I'm not sure about this, but they might be thinking that one day there might be some robot who will come and kick them out of the theaters and operate completely. But
Yes.
uh, do you agree with me that some of the undergraduates who don't have a proper knowledge of surgery or exposure to surgery might be thinking like that and avoiding surgical branches?
Yes, sir. Yes, sir. Definitely. I am totally agree with your line because the many who are not able to attend clinical postings and who are sitting at hostels, kind of thing that scenario will be happen because I am the futuristic surgeon. I am expecting that kind of scenario will be there in juniors.
I must say that they thinking like that they're not wrong, because that has happened in, if you go to a McD in London or somewhere in New York, most of the human staff has been replaced by
Robots.
robots. And if you go to a very famous airports or very big international airports, the scanning and all the luggage check-ins, the AI has replaced humans basically. But I don't think that will happen anywhere in near future, at least in the surgical branches, because the role of artificial intelligence in surgery is to aid the surgeons in making better decisions, precise decisions, better intraoperative imaging, and the surgery is becoming more and more minimally invasive.
Yes.
In the near future, I don't think it is going to happen that a robot or an AI comes into the theater and kicks the human out. But let's see what happens.
Okay, sir. And sir, what are the research opportunity we can see in the surgical specialty as you are in the NHS trust from your, matlab, you have completed MRCS and ATC. So what are the research opportunity?
So one thing that uh, I want to emphasize is there is a very low emphasis on research in Indian surgical training.
Yes.
The most of the research that you do is your thesis. It's a shame that I have to say that, but it is what it is. The max research you will do is your thesis, and maybe something you'll progress in your research in your senior residency, maybe. But in your
Yes.
training, see, you cannot uh, publish a first year trainee or a second year trainee. They cannot publish a groundbreaking paper. You understand? So the
Yes.
research has to be in phases. First, you should start with very small audits or quality improvement projects, and then you have to progress and make some changes, and then make a publication out of it. That's the way. You cannot sit today and collect the data and publish a paper. That is not going to happen. You understand? So there is no emphasis on audits or quality
Okay.
improvements. Uh, for the general surgical trainees, at least. Maybe in super specialty, because I have not had a super specialty exposure in India. Maybe in the super specialty and very big hospitals like Indo-American Cancer Hospital in Hyderabad, or some very big centers in Mumbai or Delhi, they have a good audits for their super specialty trainees. But at least 70 to 60, I'm not exaggerating, but at least 60 to 70% of the colleges who have a general surgical training program in India, they do not participate, or they do not encourage the trainees to take part in audits. And this statement also applies to teaching. The general surgical training should also be more and more involved into teaching programs. Maybe you can start slowly, first for the paramedics, the nurses, and the first year, second years. By teaching, I don't mean that you teach final year undergraduates or the first year or second year postgraduates, but you should start at some point or the other.
Okay, sir. Totally understand you. And sir, what is the things make difference in like Indian surgeon versus UK surgeon? Like you are doing practice in UK and you have just experienced the life of surgery in India also.
Difficult question to answer for me, Yash, because it's only been 4 months that I've been into NHS, but I'm enjoying it definitely.
Okay, sir.
The thing about I like about NHS is uh, the way the work is divided. It's very practical and reasonable, with no with very less stress compared to
Okay,
India,
sir.
obviously,
Yes.
and you have some personal time to work on yourself, to have some peace of mind, to spend some time with your family. That's the most important difference that I have noticed in the first 4 months.
Sir, where you see surgical branch as a specialty after 10 to 20 years down the line?
So I cannot anticipate or predict the future exactly, but what I think is we will be progressing more and more towards the subspecialty.
Okay.
Like in very big cities now, we are at the point where a hepatobiliary surgeon is different from a colorectal surgeon. We are progressing there to that point,
Okay.
but I
It's
think it will be.
it's kind of subspecialty every surgeon has to do for being as a surgeon, and they have to particularize their practice in the field of surgery so they can practice better in the future also.
Yeah, they have to create a niche for themselves and become experts in that particular subspecialty rather than being jack of all trades and master of none.
Okay. And sir, as a subspecialty and fellowship, it is necessary to do after general surgery or particular surgeon?
Do you mean is it mandatory to do a super specialty MCH or DNB, or
Yeah. Yes, sir. Yes, sir.
ask me if it is mandatory? My answer would be definitely no, because uh, when I used to work in surgical oncology in Mumbai, I had two bosses who were just MS general surgeons,
Yes.
and they had trained themselves so much in some surgical specialties that the MCI or the NMC, they had allotted some super specialty seats under them. You understand me?
Yes. Yes. Understand, sir.
So both of my bosses, they were trained in Tata for a specific period of time, but they did not have the MCH tag. But
Okay.
they were so impeccable and efficient that they used to train
They can
a lot
teach.
of super specialists each year.
Yeah. Okay. Sir, got it. Got
So,
it.
but
And
ultimately, having a MCH degree or a DNB super specialty degree, uh, it's more about the tag, and it makes the process more streamlined rather than you claiming that I have so many years of experience and I can do this and that. You understand?
yes, it is kind of the simple and spread post process we can expect.
Yeah, so there's a streamlined process that you have to give NEET SS and get into super specialty, and after that you have to train yourself to become specialized in a particular niche.
Yeah.
Maybe
Yes.
what I told about my bosses who were extraordinary and impeccable, that was okay maybe in the 60s or 70s or 80s,
Yes.
because they were from
Whereas,
70s or 80s, I'm not sure, but in this era I think you should have a super specialty degree or
okay, sir.
whatever.
And particular fellowships, definitely, sir. I am. And sir, what is the things to consider to choose as a surgical branch for our fellow juniors?
You want to decide is, as you said, what is your personality type? You want to ride a fighter jet or a Boeing
Yes,
777 or Airbus 3
I
A380?
can. Mm,
And the second thing is, what is the type of life you want?
yes.
And for my juniors who are interested into surgical specialties, one thing I would definitely want to say is don't get easily influenced by opinions, because some people who don't have a thorough knowledge, they come and say one day that okay, surgical specialty is very risky, and I have explained you that in very detail how there is a risk involved in each and every branch. Obviously, surgeons have to navigate through it much frequently. I agree, but you should learn to do it at some point of time in life. and people will come and say that you won't have time for your family, you won't have time for yourself, which is not true. I've explained that with an example again just a few minutes ago. So don't listen to those opinions, but make it very clear in your mind what is the type of personality you have, whether the specialty you want to be in, do you want to, are you happy to live with it for the rest of your life? uh,
Yes.
is it is there a good chance to make good money in that specialty? How satisfied you will be, and what is the kind of life you see yourself living in the future?
In the future. Yes. Definitely, these points we can consider to choose a particular specialty. And extremely, sir, I am pleasure to have one-to-one conversation with you. And I think we have discussed all the important factors to choose a surgical as a specialty in India and also as a foreign practices. And we have tried to dig out most information from you as a being surgeon. And sir, I just last asked to one question from you. Is there any special message you want to put for our fellow juniors who want to be a good surgeons?
Yeah, definitely. One thing I would like to say is don't fall into that. Don't only. It is very good to be in a streamlined process, like you clear NEET UG, then get a MBBS degree, then you clear NEET PG and they get a master's degree, and then you struggle at NEET SS and then get a super specialty. And it's very good and streamlined process, but you have to look at different aspects, different other aspects as well, like. I know many of my friends who have migrated to Germany. One guy is an anesthetist there, and one is a surgeon. Who have a lot of people who have migrated to UK as physicians and surgeons. And many people they say that in the United States they don't offer you surgical training, or it is very difficult. I don't know the reality, but
Yeah.
uh, there are a lot of other ways or pathways which you can opt for rather than falling into the streamlined process, which is very much the trend now in India.
Okay, so thank you so much, sir, for giving your valuable time for our fellow juniors. And we are very happy and thank you for your valuable time. It's honor pleasure to present you on our podcast. Thank you so much, sir. So,
Thank you so much, Yash. It was a pleasure to meet you, and my special thanks
oh,
to Dairy as well.
oh, thank you so much, sir.
Thank you. Bye bye.